I am Santhi Vege. I am the director of the Pancreatic Diseases Clinic at the Mayo Clinic. This is popularly known in our institution as the Pancreas Clinic. I feel this is a very exclusive, multidisciplinary pancreas clinics that I know of. The reason being, it's the only clinic, or probably one of the very few clinics, where you have a clinic running every single day. This clinic is run by a group of specialists coming from gastroenterology, endoscopic ultrasound specialists, ERCP specialists, pancreatic surgeons, and helped by radiologists who are specialists at pancreas CT scans, pancreas MRIs, and interventional radiologists who can put tubes radiologically into any of the pancreatic fluid collections or tubes, and we have pathologists dedicated to the pancreas and also basic science as well as pain management experts. If you take all of them, it's about more than 20 people, and to my knowledge this is one of the largest pancreatic experts group anywhere in the world. We see about 1300 patients per year, which is a high volume, and that's why we have the clinic every day. And the Pancreas Clinic deals with pancreatic diseases, which can be grouped under 5 headings: acute pancreatitis, chronic pancreatitis, pancreatic cancer, other benign and malignant tumors of the pancreas, and all other diseases we can group under the heading miscellaneous group. If you go step by step, acute pancreatitis, where you have swelling, inflammation, pretty bad disease, in about 20-25%, the cause for such an attack is not known. So those are the people who are referred to us. And by doing special tests like endoscopic ultrasound, secretin MRCP, which is an MRI, genetic testing for certain genetic problems, and various blood tests, we try to find cause in those unknown causes. The second group of acute pancreatitis patients who get referred to us are those who survive the attack, but they have big fluid collections which are causing infection, symptoms, etc. They come to us so that they can be drained with a minimally invasive route, not a major surgery, either through the endoscope, with radiological guidance using tubes, or with laparoscopic route. And we have specialists from each and every aspect of this minimally invasive technique, and that's where most of the centers have 1 or 2 areas of minimally invasive expertise, whereas we have from every particular division. Then for people with chronic pancreatitis who have permanent irreversible scarring resulting in pain, diabetes, the advantages of coming to Mayo Clinic are either they can get endoscopic tube placements into the pancreatic duct to relieve their pain, called stenting, or in difficult patients where you cannot get access with the regular route, we puncture through the stomach, through the substance of the pancreas, the pancreatic duct, and put a tube in the reverse direction back into the intestine. This is called rendezvous technique. Not many centers have big experience like we have been having here. And then surgeries of different sort, either to drain the pancreatic tube that is obstructed or to resect the pancreas. And then when we sometimes totally remove the pancreas for the pain, for relief of pain, you're obviously going to be a diabetic, and we prevent or minimize the diabetes risk by taking the insulin producing cells from your pancreas, which we remove, and putting them back into the liver through a blood vessel so that they populate there and start secreting insulin. This is called auto islet cell transplant. Very few centers in the country have programs of auto islet cell transplant. We are one amongst them. And for the pancreatic cancer, then we have the whole gamut of, from the early diagnosis to endoscopic diagnosis to endoscopic treatment to major surgery, and then oncology treatment. One particular area where we score over others in pancreatic cancer is when you do a major pancreatic surgery, which of course the results will depend only if you have a high volume center, and of course Mayo is one of the definitely very high volume centers. We started doing this surgery laparoscopic route, which was almost impossible to think several years ago. And we probably have one of the largest experiences in this country, more than 70 patients by one surgeon, and people are specifically being referred. Once somebody says you need a Whipple's pancreatic duodenectomy, then they come here saying that I heard that you can do it laparoscopically. Then we have the chronic pain management experts in people who are being misdiagnosed as chronic pancreatitis and being treated with endoscopic stenting but no relief. We then test them with endoscopic ultrasound. At the same time, we take their pancreatic juice from the duodenum. So we look at both the structure of the pancreas as well as the function of the pancreas, and if both of them are normal, we reassure them this is not pancreatic disease, and then they have to go through what's called pain management, which is days to weeks treatment, because the pain is mediated through the nerves, and those centers are very, very few in the country, and we have one such expert center. So we think we do a good service when people have been clarified that you don't have a pancreatic disease but this is a neuropathic pain. That's very tough to convince both the physicians and the patients, and that's one advantage. We have several patient stories which probably you can go on the website and see, like autoimmune pancreatitis, which looks exactly like cancer, and there's a patient who was told that you have 2 to 3 months to live, you have disease in your pancreas, in your liver, and the patient, after spending 2-3 months in a very, very leading institution, came here Monday morning, and by Thursday all the tests are done, and she was told that you have autoimmune pancreatitis and not cancer. Medications were started, and within a month everything melted away. So those things really do change the whole scene 180 degrees. And similarly, we have patients with coming for laparoscopic Whipple's pancreatic duodenectomy, being dismissed on the 4th day or 3rd day, and calling after 2 weeks saying they never expected that they could recover so quickly. Then we have various other stories of proper diagnosis, cutting edge technology that's being implemented. But the bottom line is the daily availability of a clinic, availability of many different specialists under one roof, surgeons, radiologists, endoscopists, gastroenterologists, oncologists, so on and so forth. And then the quickness with which you will be worked up, and the various cutting-edge technologies, all of them being present under one roof. I think these are some of the things which would make it one of the best places to be treated if one has a pancreatic disease.